One of the problems with ovarian cancer is that the symptoms that it presents with in the early stage are generic or really seem unrelated to the ovaries. So some of the very first symptoms, nobody's going to think about ovaries because they're neurologic symptoms. So you may not have good balance, you may not be able to move well, you may have weird eye movements and dizziness, you may have double vision, things like that. Nobody's going to be like, oh, I think I have ovarian cancer. But these are actually some of the first symptoms in some people, not in all people. And that's because ovarian tumors can cause an autoimmune response to the cerebellum. And so then these are all symptoms of cerebellar degeneration, and that can be caused by autoimmunity of the cerebellum caused by ovarian cancers. The other symptoms that ovarian cancer in the stage 3 and 4 can cause are just generic. You're tired, your tummy's full, you have bloating or nausea, you don't feel like eating, you get full early, you may have urinary tract infections or other symptoms related to the bladder, either some change in your bowel movements, getting softer or harder, more frequent, less frequent, something is changing. You can have weight loss and then pain. Since the ovaries are far back, you can have pain in your back or the pelvis or pain with sex. There's lots of things that cause those kinds of symptoms. Is it GI? Is it something to do with the gynecologic system? Is it something to do with the urinary tract? It's unclear because these are kind of like very unspecific symptoms. One of the other things that's kind of unusual and only in the very advanced stages is something that's called the Sister Mary Joseph nodule. And this is when the ovarian cancer has already metastasized or spread to other areas. And this will show up as a nodule or a lump and discoloration around the umbilicus. And what has happened in this case is that the lymph or the blood or even the median ligament of the bladder that goes between the bladder and the belly button has carried the cancer cells up to that area. And then you have a growth of cancer in that area around the belly button. Sister Mary Joseph nodule. Another indication of ovarian cancer could be these age spots that you get. These are called seborrheic keratoses, which are very common with aging. So if you maybe get a whole bunch of these that are new or that the ones you have change in size and start growing, then this can be a sign that there's cancer growing somewhere. And because ovarian cancer is so hard to find and it usually shows up late, this is one of the cancers that you have in the back of your mind if you suddenly get a whole bunch of these or the ones you have start getting real big. And that's the sign of Lesser Trellat.